Hello everyone, I'm Geraldine Diliwagon and today I'm going to perform the Leopold's maneuver return demonstration. So Leopold's maneuver is used to systematically palpate the gravid uterus. It is easy to perform invasive method to determine the position and presentation and the engagement of the fetus inside the uterus. So Leopold's maneuver is done after 36 weeks gestation to help the expectant mother and the healthcare provider to be better prepared for the labor, and is also determine if it's much safer for to perform a cesarean section. So prior to the conduct the procedure, I have prepared the necessary equipment needed, so which includes a pillow and towel and stethoscope. Next, I have performed the hand washing to protect my patients and myself well from infection and cross contamination. Okay, so good morning, ma'am. I'm Geraldine Diliwagon. I'm your student nurse for today. So, ma'am, may I see your wristband? Okay, ma'am, can you please state your full name?
My name is May Bacleon.
And how about your birthday?
I October 13th, 1998.
Okay, thank you, ma'am. So, alright. So, ma'am, today I'm going to the Leopold's maneuver. It is an easy method which is used to determine the position of your baby inside your uterus. So, later, ma'am, what I'm going to do is to feel your abdomen and add a little pressure so that I can feel and determine the position of your baby. So now I'm going to provide the privacy and close the door and the curtains. So, ma'am, before we begin, I encourage you to void first so that later you won't feel uncomfortable. So, ma'am, can I help you? So an empty bladder promotes a comfort and allows for more productive examination. On the other hand, an descended bladder may obscure the fetal contour and may slightly deviate the uterus. Okay. Are you done, ma'am?
Yes.
So position the patient supine with the pillow under head and flex knee would relieve the tension in the abdominal musculature, and placing a towel beneath the patient's hip will displace the uterus of the inferior vena cava and the aorta, thus preventing supine hypotensive syndrome. So now we're going to begin to be leading to expose the abdomen of the patient. So ma'am, alright to expose your abdomen. Okay, to begin with the procedure, expose the area of examination of the right-handed and the patient's right side. And now I'm going to proceed with the first maneuver, which is called the fundal grip. Okay. And palpate the uterus, which is part of the baby. It is the upper part of the uterus and maybe the fetal head or the bridge. Okay. So now next, I'm going to proceed with the second maneuver, which is called the umbilical grip. And what going to do is to palpate downwards on the lateral uterine surface, so and determine the fetal back or the fetal extremities and apply a gentle. Okay, so alright, now proceeding to the third maneuver, which is called the Holy Creep. And to do is I'm going to place my hand over the synthesis of these grafts the lower uterine segment, which is my thumb and fingers, to determine if engagement has already occurred. Okay. Okay, so now we're going to proceed the fourth maneuver, which is called the pelvic. This is done to determine the findings of third maneuver, as well as determine the presenting part, that is the hypogastrium of the mother, and also determine the cephalic prominence, and if it is the same side as of the fetal extremities, then if the head is flexed, but if the prominence is the same side of the back, and then if the head is extended. Okay, now that we are done with the maneuver, we are now going to locate the fetal back again and listen for the fetal heart tone, and locate the fetal heart tone and listen for at the less of 1 minute. Okay, ma'am, we are done the procedure. I'm going to cover up your abdomen. So now I'm going to provide the hand hygiene. Okay, for documentation. So, okay, ma'am, after the procedure, I determine your baby, your right side at your baby is in a cephalic position, which is means that head of the baby is the lower part of your uterus and it's already engaged. This is the ideal position of the baby for the labor also. And I listen your baby heart sound and had counted it. It is 125 beats per minute, and that is a normal. So, do you have any question, ma'am?
Ano?
Okay, thank you.